Romulen Pillay, Managing Director for Philips South Africa, is no stranger to this show. He joins us again with some very interesting facts. I recall our last conversation of the research that you guys announced and some of the technologies you were working with at Philips in the healthcare space. Quite amazing. And it's really good to see you again, Romulen. Thanks for joining us.
Thank you, Aki, and happy to be back on the show.
Yeah, I mean, this is what it's about. I mean, I often talk in my AI talks and technology talks how healthcare and technology is really shaping the future of healthcare. So I'm really looking forward to our chat because this is the 9th edition
Yes.
of the Future Healthcare Index. Now, why is it so important for Philips to continue conducting this survey? Because it's been going on for quite a few years now.
Firstly, as a company that's deeply involved in healthcare, it's important for us to be aware of the developments, innovation, but also the challenges that the industry is facing. I think research of this nature is aimed at adding to the body of knowledge, and it's new key topics emerging like data integration, automation, AI, etc., which is being used to overcome a lot of the challenges that the industry sees.
Yeah, no, look, that's very exciting, and of course, remote care and
Yes.
the technology is changing the face of this industry. There's no doubt about it. The challenge in South Africa is that and I guess it's not just South Africa; it's a global problem. But South Africa especially has a skills shortage across many industries. Healthcare is one of them, as we know. How is this impacting the healthcare sector? Is it making life difficult?
Absolutely. If you look at patient waiting times, this has significantly gone up, right? Because you have a shortage of staff. You then have
Yes.
fewer doctors to and nurses to patient ratios, right? You see also it's impacting the wellness of current healthcare workers, right? There's also a risk that a lot of workers leave the geographies or leave the location or booked off sick more often. So it's clear here that the research of the healthcare leaders um, need to do more with less, right? And so, in amongst these challenges, there's also a lot of innovation going to try and overcome these challenges.
Mm, mm. No, that's fascinating. And of course, the industry is looking to handle these particular shortages through virtual care and automation. And I've been watching some of the stuff that's been happening globally and here in South Africa with a great deal of interest because when you think of some conditions that some people have, medical conditions, it's not always necessary for you to go to a hospital or a clinic. I mean, this can all be done remotely. Could you unpack how these opportunities are being used and where there are any potential obstacles that lie herein?
I think it's a good question as well, and maybe I'll share a few examples as well. So, firstly, I think with automation, right, you have automation there that applies AI to reduce admin tasks, right? So, as an example, where you are involved in a procedure, usually a doctor or a nurse or a physician, after finishing a 2-hour procedure, then has to spend at least 25 to 30 minutes documenting and completing admin work. Here, the
Mm.
technology can automate the collation of information from the time the patient is in the operating procedure, operating room, and by the time the clinician has to do the report writing, the information is synthesized in a lot more efficient way so that the clinician can then spend more time on the patient care and the treatment pathways. But similarly, for virtual care, I think as the research showed, a lot of healthcare leaders are playing more emphasis on virtual care. Uh,
Mm.
Example would be in the EICU environment, which is something that we've deployed. You find that critical care is done at the bedside, especially when you have a shortage of ICU nurses. So it doesn't matter where the facility is located, a specialist or a doctor can now review patients at different locations from these EICU command centers. Similarly, you have AI that can be deployed upon a lot of these information databases and then bring about automation, but also then allow the doctor or clinician to spend more time on detecting, diagnosing, and treating. So it really allows you to reach patients in quite outlying areas but also to overcome some of these challenges you have with having staff shortages as well, right?
Yeah, very interesting. Well, look, AI is certainly very topical at the moment, and it's been like this for the last few years. And of course, AI has been around for a long time, but it's really maturing right now. We've got the technology that enables this, the cloud infrastructure, and the devices that can handle that kind of data analysis. Now, when you look at AI as a technology, there seems to be a key focus for most industries, and I'm sure healthcare is no stranger to this. Based on your research that's come out recently, how is AI being used in South Africa's hospitals and healthcare facilities? Is it a trend that's growing rapidly?
Absolutely. It is growing quite significantly. And if you look at the aim of AI, right, it's to reduce admin intensive tasks, right, to almost automate them, but also help you to arrive at a decision a bit quicker. Now, if I can use another example, we have at the bedside in patient monitoring something called patient where, for example, a adverse event could possibly be viewed at a patient bedside. So the tool then uses AI to automate early warning signals, right? And it then also verifies the data at the bedside, looking at the vital signs of the patient and then eliminating things like false alarms, etc., so that the caregiver can then intervene a lot quicker before an adverse event takes place, right? So there, the AI is bringing about efficiency, but at the same time, it's helping to reduce alarm fatigue, which a lot of nurses seem to, have trouble with that impacts them. So
Yeah,
it applies
yeah.
some intelligence. But I think you raised an important point about it as well. We can't ignore the human element around it, right? The IP from human intervention, because the value of AI is only enhanced through how we train people that are working with it, but also their input, their IP, their understanding and insights to make the AI better.
Yeah, yeah, very interesting. I mean, it's almost like augmenting people's jobs, and that as you were talking, and you hear those bleeping noises and people going unnecessarily to machines to turn them off. When you have, because you could be using AI and you can have kind of almost predictive analytics on and understand an issue before it actually occurs. And of course, data has been that key component of the healthcare sector. What is the state of data collection? Because there's all sorts of issues like governance and PAPIA Acts and who holds your data, your medical data, which is of course very sensitive data. But where do we stand in South Africa with data collection and access in the South African healthcare sector? I get the sense it's still a little bit fragmented. Maybe I'm wrong.
Now, I think that's a fair observation. So you have two focus areas, right? The one where I think the data is overwhelming and disconnected. But in other instances, I think you've seen with healthcare leaders and certainly from the research that more and more of them see that there's good value and opportunity in using the data
Mm.
for better planning, etc., right? And getting more out of it. Now, if you consider that of the world's data, 30% comes from the healthcare industry, that's a lot of data. Now, what the data, I think the real value of the data then is the insights that come from it, right? So here you could have an AI platform that sits on top of an open source platform. As an example, where you have many devices that are used in the diagnosis and treatment, having patient information. So the AI can then assimilate the data from these different devices and then put it together in a way that the physician can make a quicker diagnosis and then even detection and prepare a better treatment and care pathway. Also, the
Mm.
patient data itself can be better integrated now so that you can then have a better treatment plan for the patient and better patient outcomes.
Very, very interesting. And it's so important to understand that data, right? Because it's that key component that we can't progress forward if we don't have the right data and we don't have the clean data that's needed. And quite frankly, we've been flooded by lots of data at the moment. Trying to make sense of all of it is also a big challenge. The other thing, I was looking through your research, it found that almost all healthcare leaders report financial challenges. What are those major obstacles they face as a result of this, and how can all of this be solved?
So if you look at our healthcare system in South Africa, right? So you do have staff shortages, you have skills development needed, right? And you have infrastructure investment. To the
Yes.
point I made earlier about wanting to do more with less. But at the same time, you have a very sophisticated medical sector that has a lot of key opinion leaders and specialized research. So in both instances, the application of the data becomes very important. However, the level of investment, right, in either putting together tools that integrate that data or helping the infrastructure investment is disparate, right? I think the healthcare leaders view it as not rapid enough in the adoption of innovation, because we have really smart doctors in South Africa as well, right? And so I think the kind of clinical specialization is warranting a need to keep up with the pace of innovation. So they're requesting of the hospitals to invest more in the infrastructure. Then if you look at also, I mean, the procurement, particularly in public sector, has been highlighted recently. It needs a better process to underline to make sure that, what's needed and what's procured ends up in the right places, right, to service those needs and meet the patient outcomes and the staff of the hospital where the equipment is needed.
Now, healthcare leaders in South Africa agree that being environmentally friendly, and this is, it's, the environment is really key to every single industry. We're seeing what's going on at the moment with global warming. It should be environmentally friendly, and it should be a key focus in the sector. What kind of steps are these leaders taking to address this? So that there is that environmentally friendly environment, and we're all focused in the same direction.
Yeah, I'm extremely encouraged because when I'm dealing with a government hospital like a Califong or a Steve Biko or a Syntocare or a Mediclinic in Stellenbosch, particularly the hospital CEOs and the management staff are keenly focused on ESG guidelines, right? Lowering the carbon footprint. If we put a big piece of equipment like an MRI, making sure that this has now gone back into the circular economy. Have I taken it back as an OEM and then recycled it? So even the hospitals themselves are putting together plans to make sure that these equipments are recycled. Recently, we launched the helium-free MRIs, and the adoption rate across private radiology and public sector hospitals is quite high. So, which tells me that there's a big focus on not this helium is a non-replenishable, non-renewable resource, right? So we can save liters of helium. It helps the planet. Uh, so I think the focus and the vision is clearly definitely from my interactions on, what's good for the patient is also good for the planet. And I'm quite encouraged to see this across the spectrum in South Africa. There's also other areas, right, in reducing hazardous materials, etc., and green
Yeah.
energy. And these are quite topical. In fact, I'm starting to see a lot of hospital groups even put it into their financial reporting, particularly the private hospital groups, your Life, Netcare, Mediclinic. But also, I think there's guidelines being published for public sector as well, where these will be key performance indicators for these hospitals, which is very encouraging.
No, it certainly is, because when you look at those ESG targets, we know that 2030 is a big milestone date for many organizations, but it always seems to be the IT companies and technology companies and the fintech sector and banking that they seem to be focusing on that more than anybody else. But it's great to hear the strides that have been made in the healthcare industry with regards to those ESG targets, which are important, because every single industry should be focusing on that 2030 approach date. And Romulen, lastly, your research found that healthcare leaders are looking to collaborate with organizations in other sectors. And I find this quite interesting, because it wasn't the case in the past. What kind of value is there in these kind of partnerships?
So if you look at the continuum of care, and you'll hear many different sectors speaking about this in the healthcare industry, from preventative care through to being in the hospital, being diagnosed and treated, and then aftercare at the home. Along this continuum, there's different touch points, right? Philips itself plays a role in many of these areas, and some of the examples I gave you, but there are other industry providers as well, right? That in preventative care as well, and you look at nutrition, etc. And then we spoke about remote care once a patient is at home after hospital. So these stakeholders need to collaborate better to make sure that we're addressing the entire continuum of care and each of the needs reflected there. Also, I think there's a good will both from public and from private partnerships to make sure that we address the imbalance in access to care, particularly in South Africa. I mean, it's well known that the access to care imbalance that we have. And I think the better we can work together, it helps address that, right? And I think we can provide a better quality of care to all. But at the same time, the rate of innovation and research and development is so high, and the adoption rate in South Africa, even seen in the research, is on technology advancement is very high. So hence it will account for a lot of that being pulled into the different areas, and then the need for a lot of collaboration and cross-learning.
It's great that Philips is doing this research. Is it available online for people to view?
Yes, it is. There is a code, I think, that's available that has been published. And if you go to the website, it can be downloaded there. I didn't bring it with me on the call.
That's fine.
We can share the link. It will be in I think, in your article as well. It can be downloaded. It's a free download.
Oh, great stuff. Yeah. Well, listen, thank you very much for sharing those insights. I look forward to the 10th edition and chatting and unpacking with you, Romulen. Appreciate your time, Romulen Pillay, who's the Managing Director for Philips South Africa. Wishing you a great day further, Romulen.
Thank you.